blocked arteries don't always announce themselves with a heart attack or a stroke. In fact, your body often whispers the warnings long before disaster strikes, and those whispers show up in your legs, feet, and even your hands. The problem is, most people dismiss these signs as just aging or tiredness, when in reality, they could be the first signal of something life-threatening. Studies reveal that millions of people live with narrowing arteries and don't even know it. Subtle symptoms, like leg pain, tingling, or cold skin, are too often ignored until the blockage becomes severe. But if you learn to recognize them early, you have the power to act before it's too late. This isn't about fear, it's about awareness. Knowing what to watch for could mean the difference between a simple doctor's visit and a serious medical emergency. And the best part, these signs are easy to recognize once you know what they mean. In this video, we'll uncover the clearest warning signs of blocked arteries and explain what your body might be trying to tell you. Subscribe to the channel now, so you don't miss vital health information that could protect you or someone you love. Scientific research has provided increasingly accurate answers about what constitutes a normal penis size. Large-scale studies, some involving over 15,000 men worldwide, have given researchers reliable averages for both flaccid and erect measurements. According to a 2023 review published in the British Journal of Urology International, BJUI, the average flaccid penis length is approximately 9.1 centimeters, 3.6 inches, while the average erect length is about 13.1 centimeters, 5.2 inches. These numbers are based on standardized clinical measurements taken by professionals, not self-reported data, ensuring greater accuracy. It is important to differentiate between flaccid, stretched, and erect length, as they do not always correlate perfectly. A flaccid penis can appear shorter but may lengthen considerably when stretched or erect. Studies have shown that the average stretched flaccid penis length, when gently pulled from the base to the tip, closely mirrors the eventual erect length, typically measuring around 12.9 centimeters, 5.1 inches. This explains why urologists often use the stretched measurement in clinical research, as it provides a more reliable indicator of maximum size. Another key point is the sheer diversity of sizes found in these studies. Even in research with thousands of men, measurements range widely, showing that normal is not a single number but a broad spectrum. In the BJUI study, for example, the smallest erect lengths recorded were just under 5 centimeters, 2 inches, while the largest exceeded 20 centimeters, 8 inches. Yet all fell within what doctors classify as healthy variation, meaning size alone rarely indicates a medical issue. Finally, the significance of these studies goes beyond simple curiosity. Many men quietly worry about whether they measure up, leading to unnecessary anxiety and self-doubt. By grounding the conversation in solid scientific evidence, urologists aim to dispel myths and reassure patients that the vast majority of sizes are entirely normal. In fact, understanding these averages often helps men focus on overall health rather than obsessing over a ruler. When discussing penis size, many people focus solely on length, but urologists emphasize that girth, the circumference or thickness, is equally important. Girth is measured around the shaft, usually at the midpoint, and provides a better sense of overall volume than length alone. In studies, girth has been linked not only to aesthetic preferences but also to how a penis functions in terms of comfort and fit during intimacy. Ignoring girth means overlooking half the picture. Interestingly, several preference studies suggest that girth may actually matter more to partners than length. Research published in the Journal of Sexual Medicine found that many women reported greater satisfaction with thickness than with added centimeters in length. This is because girth contributes more directly to sensations of fullness, making it a critical factor in how a penis is perceived and experienced. From a medical perspective, both measurements, length and girth, are essential for proper research. Urologists rely on accurate data to diagnose potential abnormalities, fit medical devices like condoms or prosthetics, and advise patients on surgical or therapeutic options. Without girth measurements, much of this work would be incomplete or misleading. Ultimately, Understanding the difference between length and girth helps men better interpret what average size really means. A penis might appear longer but be thinner, or shorter but thicker, and still fall well within the healthy range. Knowing that these dimensions work together, not in competition, can ease insecurities and shift the focus toward overall sexual health rather than a single number on the ruler. Accurate measurement of penis length requires following a standardized method, just as researchers do in clinical studies. The proper way is to press a rigid ruler firmly against the pubic bone, at the base of the penis, and measure straight to the tip of the glans. This ensures consistency and eliminates the variation caused by fat tissue in the pubic area. Without pressing to the bone, the reading may be shorter and misleading. It's essential to measure both erect and stretched flaccid length for a complete picture. The stretched flaccid length, gently pulling the penis straight before measuring, closely reflects the eventual erect size. Urologists rely on this method in medical research because it's easier to standardize than waiting for natural erections, which can vary in firmness and timing. The ruler used should be rigid, ideally made of plastic or metal, to avoid bending and distorting the measurement. Flexible or curved rulers can introduce error, and even a few millimeters can matter when comparing data. Careful positioning, taking the measurement along the top side of the penis, is also crucial for accuracy. By adopting this method, men can achieve a measurement closer to clinical standards and avoid the common mistakes seen in self-reported surveys. More importantly, following the correct technique helps prevent unnecessary anxiety, because when the ruler is placed correctly, the number is both honest and reassuring. Measuring penis girth is just as important as measuring length, and it requires a different approach to ensure accuracy. Instead of a ruler, a flexible measuring tape, like the kind used for tailoring, should be wrapped gently around the shaft. This tape allows you to capture the full circumference without leaving gaps or squeezing too tightly, which would distort the reading. For consistency, urologists recommend measuring at the midpoint of the shaft rather than near the base or tip. This mid-shaft standard is used in research studies to create comparable results between subjects. Measuring in multiple locations may show slight variations, but the midpoint is the most representative number for medical and scientific purposes. It's also helpful to record girth in both flaccid and erect states. Just like length, girth changes significantly between these conditions, and both numbers provide valuable context. An erect girth measurement is particularly important in studies of sexual satisfaction and condom sizing, while flaccid girth can help assess overall health and blood flow. Using the right tool and technique makes all the difference. A tailor's tape is ideal, but a strip of paper or string can be used in a pinch. Just mark where it overlaps and measure with a ruler afterward. By following this method, men get a measurement that aligns with clinical research, reducing uncertainty and ensuring they are comparing apples to apples when looking at averages. Penis size varies greatly from one man to another, and science shows this is perfectly normal. Genetics play the primary role. Just like height, hand size, or shoe size, penis size is largely determined by the genes inherited from one's parents. Hormonal influences during puberty further shape growth, meaning some men experience more pronounced development, while others remain closer to the global average. Cultural curiosity has driven researchers to compare sizes across different regions of the world. Studies reveal modest but real differences between continents, with certain populations averaging slightly longer or thicker measurements. However, experts caution that these are statistical trends, not rigid rules, as individuals from any region may fall anywhere on the size spectrum. Even within a single country, variation is enormous. One study with thousands of participants showed that two men from the same city could have completely different measurements, yet both would still be considered medically normal. This wide range highlights that there is no single ideal size, only a continuum of healthy variations. Understanding this diversity is crucial for easing concerns among men who might compare themselves to misleading stereotypes. When seen through the lens of genetics, hormones, and natural variability, penis size becomes less of a competition and more of a biological trait, one that rarely affects function or health in the way many fear. Penis size measurements are not always static, Many factors can cause temporary changes that should not be confused with permanent size. Temperature is one of the most obvious influences. Cold environments cause the penis to contract, while warmth allows it to relax. Stress and anxiety have similar effects, as the body naturally redirects blood flow away from non-essential functions when under tension. Sexual arousal is another temporary factor, determining how firm and elongated an erection becomes. Even the same man can measure slightly differently on separate occasions, depending on his level of arousal and comfort at the time. This variability explains why clinical studies use standardized methods to limit these fluctuations and ensure reliable data. Some factors, however, lead to permanent changes over time. Conditions like P3NIS disease, which causes curvature and shortening due to scar tissue, or pelvic surgeries that impact blood vessels or nerves, can alter length and girth in lasting ways. These medical issues often require professional evaluation and, in some cases, treatment. Aging also plays a subtle role in long-term change. Over decades, the penis may lose some elasticity, and the suspensory ligaments can relax slightly, leading to a small but noticeable reduction in apparent length. While this is a natural part of aging, staying healthy and maintaining good circulation can help minimize its effects. Many men measure themselves at home, but research shows these numbers are often unreliable. Self-measurement tends to lead to overestimating size, partly because of wishful thinking and partly because of improper technique. When men report their own measurements in surveys, the averages are usually higher than those taken by medical professionals in controlled settings. The main reason for this inaccuracy is inconsistency in how the ruler or tape is used. Some men fail to press the ruler firmly against the pubic bone, stopping at the skin instead, which shortens the reading. Others hold the tape loosely when measuring girth, inflating the circumference. Small mistakes like these can add, or subtract, several millimeters, enough to skew results. Clinical studies use strict protocols to avoid these errors, ensuring all participants are measured the same way. DIY measurements, by contrast, vary widely, making comparisons to scientific averages misleading. A man might think he is above or below average based on flawed technique, creating unnecessary anxiety or misplaced confidence. For those who want more accurate numbers, a few tips can help. Always measure from the pubic bone, use a rigid ruler for length and a tailor's tape for girth, and take multiple readings to ensure consistency. By correcting these common mistakes, self-measurement can approach the reliability of clinical methods and provide reassurance instead of confusion. Reliable information about penis size does more than satisfy curiosity. It can significantly improve men's mental and emotional well-being. Many men quietly carry doubts about whether they are normal, leading to unnecessary anxiety and even relationship stress. By presenting scientific facts, urologists help dismantle myths and provide reassurance grounded in reality rather than rumor or insecurity. Accurate data also plays a key role in setting realistic expectations. Men who believe that the average size is far larger than reality often compare themselves unfairly, fueling feelings of inadequacy. Understanding that the majority of men fall within a healthy, normal range allows individuals to shift their focus toward overall sexual health, confidence, and intimacy rather than a single measurement. For those still struggling with insecurities, consultations with a urologist can be transformative. These specialists not only clarify what is normal but also address any real medical concerns, from erectile health to conditions like P3NIS disease. Many men discover that what they feared was a problem is in fact well within the expected range, or easily manageable with guidance. Ultimately, the conversation about size is really a conversation about health, education, and self-perception. When men are equipped with clear, trustworthy information, they are less vulnerable to unrealistic comparisons and false promises of miracle enhancements. Instead, they can focus on what truly matters, maintaining physical health, emotional balance, and fulfilling relationships. Before we wrap up, consider joining our channel's Members Club for exclusive updates, in-depth health guides, and early access to content that could make a real difference in your life. Staying informed is one of the best investments you can make for your health. The truth is simple but urgent. Blocked arteries rarely appear overnight. Your body sends warnings, sometimes for months or years, but it's up to you to pay attention. Ignoring leg cramps, numbness, or persistent fatigue doesn't make them go away. It only lets the problem grow silently. We've seen today how these signs aren't just about your legs. They can point to heart disease, stroke risk, and more. That's why awareness isn't optional. It's essential. Now here's the next step. Don't keep this information to yourself. Share it. Talk about it with family and friends. And if you found this video valuable, subscribe, turn on notifications, and help spread life-saving